So I was first introduced to haematology as a junior doctor at Adam Brooks Hospital in Cambridge, where I worked with Robert Marcus. I really enjoyed that role, and particularly because I liked the autonomy in that one saw the patients, one performed the bone marrow biopsies, one looked down the microscope and made the diagnosis and then initiated the treatment. What I really struggled with in that job was within 6 months, patients, particularly with acute leukemia, would relapse, and so that seemed a very sad situation. I was very keen to try and improve and move the field forward. So after leaving Adam Brooks, I went to University College London Hospital. That was a different experience in the capital of the UK, and there I also did a junior doctor role. I decided at that point, after a year in haematology, that I definitely wanted to specialise in it, but at the time there weren't posts within the UK, so I went temporarily to Australia for 6 and then 18 months to work there, and in that time I got a lot of experience in morphology. But I'd really enjoyed my time at University College London, particularly been inspired by Professor David Lynch, and knew that I was interested in lymphoma, so came back to London temporarily at the Hammersmith and then to University College London to train as a registrar. And in that time under David Lynch, I became a clinical fellow working on lymphoma trials, and David was a complete inspiration to me and where the field of lymphoma had gone and where it could be developed further. During that time, I also expressed an interest in the pathological understanding of lymphoma and the laboratory work, and so I was privileged enough to be able to come up to HMDS in Leeds to do initially some research and then to have a clinical academic post. And in that time I realised that that was a really privileged role to have, both doing clinical work and laboratory work.